Our different programs, again, starting off with our residential, which is our highest level of care. We offer 24 hours of care, 7 days a week, and that is in our residential setting, which is located over on Ohio Street, which is separate from the building that we're currently in now. Patients sleep there and do all of their programming there throughout the day. And then we do have 7-day-a-week PHP programming, and PHP essentially stands for partial hospitalization programming. And with that, somebody is coming in for the start of breakfast, say at 9 a.m., and is staying with us until 4 p.m., and then will go home and practice the skills themselves with their families, with their friends, with the recovery community. We also have supported housing available to our PHP patients, and so they practice their skills of recovery at night on their own, and then return to programming the following day. Our lowest level of care right now is intensive outpatient programming, and that can range anywhere from 3 hours per day for one group, 3 times a week, to 7 days a week. We just started our 7th day of programming here for IOP. So we really kind of span all levels for both eating disorders, which is our specialty in how eating, the partnership with Eating Recovery Center came to be, as well as our mood and anxiety programming is offered at residential PHP and IOP levels of care as well.
Okay. Can you tell us a little more information about eating disorders in general, kind of like just a generalization of it?
Sure. General things to know about eating disorders, they don't discriminate. So when it comes to statistics, right now roughly there's about 20 million women and 10 million men that suffer from some type of an eating disorder in their lifetime. And with that, again, it's all ages, all races, all genders, all types of socioeconomic status. The most common ones are anorexia nervosa, and that's usually characterized by somebody who is significantly underweight for their age and for their height, usually demonstrate a fear of being overweight or becoming fat. They might have a morbid fear of eating or be fearful around food. They may or may not engage in any kind of compensatory behaviors, which are behaviors to get rid of food or prevent weight gain. Bulimia nervosa is another common eating disorder that we see here at Insight, and that is usually characterized by binge eating episodes where somebody is eating a significantly large amount of food in a short period of time, more so than what would be considered normal for most people to eat within that time frame, and then engaging in compensatory behaviors to rid themselves of the food and to prevent weight gain. Purging or compensatory behaviors could be self-induced vomiting, it could be excessive exercise, so there's a variety of behaviors, unfortunately, that people use to prevent the weight gain. And then actually the most common eating disorder, which is a newer diagnosis in our eating disorder world, is binge eating disorder, and that is one of the most common eating disorders for adults in the United States. And so you would see somebody similarly engaging in some of the binge eating episodes, but they're not going to be using the same kind of compensatory behaviors that somebody with bulimia nervosa might use, or even anorexia nervosa might use to rid themselves of the food.
Okay, that's very interesting. And you spoke about fitness. Have you ever encountered a case where fitness was an actual type of, I don't want to say a contributor, but kind of just, I work out too much and it's almost where I developed a kind of eating disorder thing where I didn't want to get fat or something like that. So you have patients like that?
Definitely. And one of the things that I think the entire eating disorder field is really struggling with right now is the tech world and the digital age and day that we live in right now. There's so much more information out there to contend with. Fitness apps, diet apps. There's often the intention behind it is usually pretty benign in the creation of these applications and websites and diet programs with the goal of being healthier, being more mindful, and really the underlying premise of them is self-monitoring, which we actually do advocate for as part of our eating disorder treatment here at Insight. And at the same time, if put in the hands of somebody that is already struggling with self-esteem issues, with struggling with weight issues, or how they feel about themselves and their body, it can actually create more of a destructive path for them. And so oftentimes women and men are coming into us for treatment that started off just trying to be healthy, and over time it got out of control. They might be using a fitness app to track their calories that they're taking in, just trying to be more mindful and aware of it, tracking the calories that they're burning through exercise as a way to motivate them. You may be seeing people walking around your school with a Fitbit on. And so those kind of technologies are all out there with the intention of helping people to be healthy. And the people that we see, unfortunately, they either can contribute to the development of an eating disorder or make it significantly worse. And so that's a lot of times what we see here.
Is there a certain age type group or anything, or is it particularly anybody really?
For
The eating disorders or anything like that, especially with the fitness? Is it younger, more generation towards people? Because, younger people are using the apps.
Yeah, we're really seeing it at all ages. I think predominantly anywhere from our adolescents, from the first time they get their cell phone all the way to, I was just talking with a patient the other day about how her mother has downloaded more diet apps and fitness apps than she has. So it really does span the ages. Again, they're free, they're at your fingertips, they're easy to get a hold of. And so we really are seeing a wide range. I would say most often, though, the more compulsive behaviors with the applications come between like the 18 and 30 range. That's what we typically see most often here in our program, at least. But I would say about 80% of the patients that come into our program have had or do still have, and then we work with them and helping them to delete them, the apps from their phones.
Now, from your personal opinion, do you think that they're actually accurate as far as, I know they do like certain height and your weight and things like that, but do you honestly think that there's some, I don't want to say inaccuracy, but kind of just, like, okay, if I'm 5'1", and I'm 120 pounds, they might say I need to eat more, which might be fine in the medical world, but the apps tell me I need to eat more, so therefore, you know what I'm saying? Kind of like that area. Do you think that there's actually some fallacy in that?
I have mixed opinions on it, and again, it depends on the app itself. There are some apps that are more helpful and healthy than others are. It never takes the place of an actual live person, though, and so I always recommend seeking out the care of a professional, when you're really looking for very specific guidance and information. I think apps are there to be a tool to be utilized to help think about it, or can be used in a helpful way to structure, and at the same time, if you're never questioning what's going on behind that, that's probably an issue. So we've had some patients that, again, who can be at a very healthy BMI, and at the same time, they're engaging in significant compensatory behaviors that they're very unhealthy, and the app will keep telling them, oh, you're doing a great job, or give them the smiley face, or the thumbs down that they didn't make their steps that day, or they didn't achieve that goal that day. So it also depends on how people set the apps to tune into what their goals are, and it's really what the goal is, if it's healthy or if it's not healthy.
Definitely. So you said you would recommend it to some patients, or what is the goal here? You kind of want to, because I know with the eating disorder thing, you kind of want to eliminate them being stressed out from eating, a certain amount of calories, things like that. So would you recommend it to some patients, or like you said, go see a professional doctor about it?
The type of apps that are out there right now, the ones I think you're mostly asking about, no, we don't recommend those kind of apps to our patients. And the reason for that is, again, the immediate feedback it gives in an unhelpful way. Sometimes there are pejorative comments that come along with that when you haven't met your goal that day, when it's telling you to eat more or less, and really, they're here and they're working with a dietitian. We do actually have some healthier recovery apps that we do recommend, and that's something to consider as well. There are actually some healthy apps and information and websites out there. Here, we do encourage healthy self-monitoring, and we do that in the context of the treatment center.
Okay. Could you elaborate on some of those apps, maybe one or two that's actually people use here?
Here we do use Recovery Record, which is one of the newer and more advanced, particularly for eating disorders. And then again, there's some healthy blogs, and one of our partner programs, Ashley Solomon, runs a really great Nourishing the Soul blog that she does, and she talks about developing a healthy relationship with her body and being able to utilize resources in a responsible, healthy way. And so those are the types of things that we would encourage.
And how do you feel like working here has changed your
That is a loaded question.
life?
You know, again, it gives me the ability here at Insight. It was founded by people who specialized in eating disorders. We also treat mood and anxiety disorders, but it allows me to do what I love to do every day with people I really want to work with and continue to help in treating eating disorders and in partnering with Eating Recovery Center based out of Denver, who really are the thought leaders in eating disorders. Again, we're continually growing and changing, which helps me to keep growing and changing. I happen to have been in eating disorders for quite some time, but there's always more things to learn, and it's extraordinarily fascinating and quite a devastating disease at the same time.
Okay. Did you have any questions, Shane?